good to have you with us in this edition of the Urban Debate. Viewers, tonight I start off with a heartbreaking story. A story of a family living in one of India's biggest metros, and the plight that this family had to face. You cannot even imagine that this would happen in a city like Bengaluru. The pain, the struggle. A woman who was pregnant and went into labor was taken to 4 different hospitals over a period of several hours. Her brother, desperate, drove her around in an auto rickshaw, trying to go to get admission in one hospital or the other. At every hospital in the city of Bengaluru, she was denied admission. Some said beds are not available. The others said you need to have a COVID test report before a non-COVID patient can be admitted. This is the situation. In a city like Bengaluru, the woman, viewers, was forced to deliver inside the auto rickshaw. And within 30 minutes, her baby died. Woman was bleeding profusely, and it is only after this nightmare that finally the 4th hospital admitted her, took her in, and began to treat her. Up until then, up until the time when she was in labor, up until the time when she was in pain, when she was about to give delivery to her child, no hospital gave her admission. Imagine now, if this is the reality in a city like Bengaluru, then what would happen in any small town, in any small village of our country? What would be the plight of anybody who goes looking for emergency help? If this is the reality of India's biggest metros with the best of the infrastructure, with world-class support system available, and this is what happens. So tonight, I only have one question. How did Bengaluru reach this place? How is it that we were not able to save this woman's child? How is it that we were not able to find a one single bed in the entire city of Bengaluru? What should this family have done to get any kind of help? Listen in to the husband, shattered, heartbroken. Listen and narrate his entire ordeal.
ಶ್ರೀರಾಮ್ಪುರಂ ಕಲ್ ಹಾಸ್ಪಿಟಲ್ ಅಂತ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ ಒಂದು, ಅಲ್ಲಿ ನೋಡಿಕೊಂಡು ಆಮೇಲೆ ಮಲ್ಲೇಶ್ವರಂ ಬಂದ್ವಿ. ಇಲ್ಲಿ ಕೋವಿಡ್ ಟೆಸ್ಟ್ ರಿಪೋರ್ಟ್ ಇಲ್ಲ ಅಂದ್ಬಿಟ್ಟು ವಾಪಸ್ ವಾಣಿ ವಿಲಾಸ್ಗೆ ಹೋಗಿ ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡಿಸ್ಕೊಂಬನ್ನಿ, ಆಮೇಲೆ ಇಲ್ಲೇ ಸೇರಿಸ್ಕೊಬೇಕಂತ ತಕ್ಷಣ ಹೇಳಿಲ್ಲ. ಬಟ್ ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡಿಸ್ಕೊಂಬನ್ನಿ, ನಾವು ವಾಣಿ ವಿಲಾಸಲ್ಲಿ ಮಾಡಿಸ್ಕೊಳ್ಳಿ, ಅದು ಚೆಕ್ ಮಾಡಿ ಅಂತ ಹೇಳಿದ್ರು. ಅಲ್ಲಿ ಹೋಗಿದ ತಕ್ಷಣ ನಾವು ಕೋವಿಡ್ ಪೇಷೆಂಟೇ ಜಾಸ್ತಿ ಇದ್ದೀವಿ, ಸೆಕ್ಯೂರಿಟಿ ಝೋನಲ್ಲಿ ನಿಲ್ಲಿಸ್ಬಿಟ್ಟು ಚೆಕ್ ಮಾಡಿಸ್ಬಿಟ್ಟು ವಾಪಸ್ ಕಳಿಸ್ಬಿಟ್ರು. ಅಲ್ಲಿಂದ ಮತ್ತೆ ಕಲ್ ಹಾಸ್ಪಿಟ್ಲ್ ಕರ್ಕೊಂಡೋದಾಗ ಅವ್ರು 5 ಗಂಟೆಗೆ ಅಡ್ಮಿಟ್ ಮಾಡ್ಕೊಂಡ್ರು. 6:30 ಆದಮೇಲೆ 7 ಗಂಟೆ ಆದಮೇಲೆ 8 ಗಂಟೆ ಆಯಿತು. ಲಾಸ್ಟಾಗಿ 8 ಗಂಟೆಗೆ ವಾಪಸ್ ಅವರು ಕಳಿಸ್ತಾರೆ ಈಚೆ. ಕೋವಿಡ್ ಟೆಸ್ಟ್ ಇಲ್ಲ, ದೊಡ್ಡ ಡಾಕ್ಟರ್ ಬರೋಲ್ಲ, ನೋಡಲ್ಲ, ಕರ್ಕೊಂಡೋಗಿ ಅಂತ ಜಸ್ಟ್ ಅಲ್ಲೇ ಕಳಿಸಿದ್ದಾರೆ. ಅಲ್ಲಿಂದ ಬರ್ಬೇಕಾದ್ರೆ ಅವ್ರು ಹೇಳ್ತಾವ್ರು, ನಮ್ಮ ಹೆಂಡತಿ ಮಗು ಹುಟ್ಟೋ ಥರ ಇದೆ, ಮಗು ಆಗೋ ಥರ ಇದೆ ಅಂತ. ತಕ್ಷಣ ಅಲ್ಲಿ ಆಟೋದಲ್ಲಿ ಹತ್ಕೊಂಡ್ಬಂದ್ಲು. ಮಲ್ಲೇಶ್ವರಂಗೂ ಹಾಸ್ಪಿಟಲ್ಗೂ ಮಿಡಲಲ್ಲಿ ಮಗು ಹುಟ್ಬಿಡ್ತು. ರಾತ್ರಿ 3:00 ಇಲ್ಲಿ ಬಂದಿದ್ದು. 4 ಗಂಟೆ 4:15 5 ಗಂಟೆವರೆಗೆ ಇವ್ರು ಇಟ್ಕೊಂಡ್ರು. ಇವ್ರು ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟು 5 ಗಂಟೆಗೆ ವಾಣಿ ವಿಲಾಸ ಕಳಿಸಿದ್ರು. ಅಲ್ಲೋದ್ರೆ ಅಲ್ಲೊಂದು ಅರ್ಧ ಗಂಟೆ 5:30 ವಾಪಸ್ ಕರ್ಕೊಂಬಂದು ನಮ್ಮನ್ನ ಹತ್ರನೇ ಏನೇನೋ ಮಾತಾಡಿ ಕಾಲಿಗೆ ಬಿದ್ದು ಸೇರಿಸಿ ಅವರು ವಾರ್ಡ್ಗೆ ಹಾಕಿಲ್ಲ, ಬರೀ ರಿಸೆಪ್ಷನಲ್ಲಿ ಕೂತ್ಬಿಟ್ಟು ಶ್ರೀರಾಮ್ಪುರಂ ಪೊಲೀಸ್ ಸ್ಟೇಷನ್ ಹತ್ರ ಕಲ್ ಹಾಸ್ಪಿಟಲ್ ಅಂತ ಅವ್ರು ಕರ್ಕೊಂಡೋಗಿ ಬರೀ ರಿಸೆಪ್ಷನಲ್ಲಿ ಚೇರಲ್ಲಿ ಕುಂಟಿಸ್ಬಿಟ್ಟು 7 ಗಂಟೆ 8 ಗಂಟೆವರೆಗೆ ಇಟ್ಬಿಟ್ಟು ಅವರು ವಾಪಸ್ ಕಳಿಸ್ಬಿಟ್ರು. ಯಾವ ಬೆಡ್ಡು ಎಲ್ಲೂ ಕೊಟ್ಟಿಲ್ಲ. ಮಗು ಆದಮೇಲೆ ಅಷ್ಟೇ ಅವ್ರಿಗೆ ಬೆಡ್ ಕೊಟ್ಟಿರೋದು. KC ಜನರಲಲ್ಲಿ. ನನ್ನ ಮಗು ಹೋಯ್ತು, ನನ್ನ ಮಗು ಮತ್ತೆ ಬರೋಕ್ಕಾಗಲ್ಲ. ಸೊ ನಾನು ಮಾತಾಡೋದು ಅದರಲ್ಲಿ ಯೂಸ್ ಅಂತ ಹೇಳೋಕ್ಕಾಗಲ್ಲ. ನನ್ನ ಮಗು ಬರೋಕ್ಕೋಸ್ಕರ ಮಾತಾಡ್ತಿಲ್ಲ. ಗೌರ್ಮೆಂಟ್ ಕಡೆಯಿಂದ ನನಗೇನು ರಿಕ್ವೆಸ್ಟ್ ಅಂದರೆ, ಕೋವಿಡ್ ಟೆಸ್ಟ್ ಮಾಡ್ಕೊಂಡ್ಬಂದು ಡೆಲಿವರಿ ಮಾಡೋದನ್ನು ತಪ್ಪು. ಫಸ್ಟು ಡೆಲಿವರಿಗೆ ಅಡ್ಮಿಟ್ ಮಾಡ್ಕೊಳ್ಳಿ, ಕೋವಿಡ್ ಟೆಸ್ಟ್ ಮಾಡ್ಕೊಳ್ಳಿ, 10-15 ನಿಮಿಷ 20 ನಿಮಿಷ ಅರ್ಧ ಗಂಟೆ ಆಗಲಿ ರಿಪೋರ್ಟ್ ನೋಡಿಬಿಟ್ಟು ಆಮೇಲೆ ನೀವು ಅಡ್ಮಿಟ್ ಮಾಡ್ಕೊಬೇಕು. ನಾವೆಲ್ಲ ಮಾಡ್ಕೊಂಬರ್ಬೇಕಂದ್ರೆ ಒಂದು ವಾರಕ್ಕೆ ಮುಂಚೆ ಕೋವಿಡ್ ಟೆಸ್ಟ್ ಬಂದು ರಿಪೋರ್ಟ್ ಬಂದರೆ ಒಂದು ವಾರ ಆದಮೇಲೆ 3 ದಿವಸದಲ್ಲಿ ಮತ್ತೆ COVID-19 ಅಟ್ಯಾಕ್ ಆದರೆ ಎಫೆಕ್ಟ್ ಆದರೆ ನಾವೇನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ನೀವು ಏನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅಡ್ಮಿಟ್ ಮಾಡಿದಾಗ ಚೆಕ್ ಮಾಡಿ ರಿಪೋರ್ಟ್ ಕೊಡಿ, ಮಗುನ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಳ್ಳಿ. ನಂತರ ಪ್ರಾಬ್ಲಮ್ ಯಾರಿಗೂ ಆಗೋದು ಬೇಡ.
That is what he had to say. His wife is now getting treatment, but that entire ordeal, that struggle to find one place when she is in pain about to deliver a child in labor, how will he ever get over that trauma? And who is accountable for this plight of his, for what he has gone through and his wife has gone through? I'll tell you a little bit more about what's going wrong in the city of Bengaluru. Here are the things that Mirror Now, through its investigation, has actually found out. There is a shortage of beds. On paper, everything looks fine. On paper, the government and the authorities would have you believe that there are more than enough beds available. But if you actually start making calls to the hospitals, which we did, one after the other, those hospitals turned us away, saying there are no beds available. There is a mismatch. So the authorities said, let's create a database. We will come up with an app, just like the Aam Aadmi Party did in Delhi, and that app will tell you where the beds are available. Database shows beds are available. Call up the hospitals, there aren't any beds. One of the other big problems that in fact we've already highlighted here several times, viewers, is the lack of medical staff. The situation in Bengaluru is so bad that the doctors themselves are actually putting out appeals, asking people to come to work. Now, some of them out of fear are not joining work. Others have been infected or come into some contact with somebody who was infected and so are in quarantine and cannot come to work. And in general, as the caseload actually goes up, there wasn't really a plan in place of what to do. And that continues to be one of the biggest problems. Ambulances are turning up late. In fact, our reporters has even found out and spoken to ambulance operators, and they're charging exorbitant amounts as well if they come. No wonder this man actually took his family in an auto rickshaw to the hospital. These are problems that the government refuses to acknowledge. Because if you had to hear Chief Minister Yediyurappa today, you would believe there is absolutely nothing going wrong in the city of Bengaluru, except that the cases went up in pure statistics because people from outside Bengaluru, Maharashtra, Tamil Nadu and elsewhere came back to the city and to the state of Karnataka. Denial only survives and only works for a few days, viewers, not for longer than that. Let's say good evening to the panelists who are joining us right now. Mr. Rajashekara, political editor of Bangalore Mirror, joins us this evening. Dr. Sylvia Karpagam, public health doctor and researcher. Dr. Sudarshan Ballal, chairman of the Manipal Hospital. And Mr. Vivek Reddy, spokesperson of the BJP in Karnataka. Mr. Reddy, how is it possible that in a city like Bengaluru, a family went from one hospital to the other, but nobody took a woman in labor?
Well, I think, first of all, Tanvi, it's really disappointing. It's really sad. I think the failure is at the system of the doctors. The doctors have not been able to respond promptly in Victoria Hospital and in other government hospitals where this couple have gone. It's really sad and disappointing. I'm sure that the government will be looking at it and will try to correct the situation. This must not have occurred at all. I mean, no, it is basic humanity that the patient in grief, a patient who is pregnant, is admitted to the hospital immediately. The excuse that these are COVID hospitals and therefore there are COVID tests are required is also not a legitimate excuse, because normally there are maternity wards that are exclusively available at government hospitals. I think the government will closely look at this, will also be looking at bringing the doctors to dock, asking them why this has been done, and also issuing notices to them, as this should not have been the situation that has occurred. Now, apart from this, the overall situation in Bangalore, I think the government has done a good job in trying to create more beds, in trying to create infrastructure, and in bringing in lots of things that were earlier not there, infrastructure, and in trying to get the act together in order to meet this COVID challenge. And now one of the largest beds in the world is being created in a single setup with about 10,100 beds. This is at the Bangalore International Exhibition Center, where most of the patients who are mildly or severe, who are facing mild symptoms or severe symptoms, will be admitted there and will be cared for by a staff of about 2,200 people. I think these are all how the government has built up the infrastructure over the days, because this is an unprecedented situation. We find that even in Delhi, the AAP government was also in a difficult situation. That's when Mr. Amit Shah stepped in and brought in about 10,000 beds. This is the sort of immediate response that we are seeing in Bangalore. And there are cases where, I'm not saying it is not there, there are cases where some patients have not been able to find beds, and many cases where private hospitals are turning away patients who have come in. The government is trying to sensitize the local police departments and asking the police departments, it has issued circulars asking the police departments to ensure that they are admitted into the hospitals. And the private hospitals are asked, or if not coerced, or if not warned, that if they don't admit, there will be serious repercussions. Just about yesterday, the government also issued severe action.
But that's not working, Mr.
Action.
Reddy. Okay, go ahead, please. Who issued severe action against?
Against Vaidehi Hospital, which said that it will not treat COVID patients, though it was a big hospital, being a medical college with super specialty facilities, but still it stuck to its stand that it will not bring in COVID patients. So there was an immediate response by the government. Government is taking action. So this is the sort of recalcitrance we are seeing, the stubbornness and indifference of private hospitals in not bringing their doctors in, their whole fleet in order to face this challenge. I think that has to be addressed by the government, and government is taking severe action.
Okay,
if you look at the entire medical infrastructure of this country, just last sentence, if you look at the medical infrastructure of this country, the government is there for about 30% of the entire medical infrastructure. That's the framework. And 70% is led by is initiated and undertaken by the private facilities. So therefore, it's a combination of the two that has taken the medical health infrastructure in this nation forward. I think the private players also must come forth as corona warriors and face this situation and face this challenge.
No, I want to understand, Mr. Reddy. Mr. Reddy, it's easy for everybody to say it on camera. And I say this because in the last 1 week, repeatedly, we've asked this question to Karnataka ministers about action against hospitals, about what is being done if you claim that the private hospitals are not cooperating. And every time we've been told, we need to work together. There is a little amount of hesitation, but we are telling them, we are warning them, we are asking them, we are requesting them, we are speaking to them, and nothing is happening, except that people are suffering on ground. Now, I want to know what action will be taken against these hospitals, private or government. The 4 hospitals that this woman went to, that this lady in labor went to and was denied admission.
Well, I think that's a good point you raised. Today, there has been a serious discussion with the task force. The task force is the force of experts comprising of a committee of experts led by Devi Shetty and others, who are all involved in trying to prepare a proper response to this COVID-19 challenge. I think that's where this will have been discussed. We will have to know the eventual results. I think the government is very serious on taking action, and it will initiate action from tomorrow. The sort of action that will be initiated, we will have to see from the decisions, eventual decisions of the task force today.
Well, let me bring in Dr. Sudarshan Ballal on this. Dr. Sudarshan Ballal, and what Vivek Reddy says is exactly what the entire government of Karnataka repeatedly tells us. The blame and the onus has been put on private hospitals. Why is it that the apps are showing beds are available? The government's database and the civic body's database says over 3,000 beds are available in private hospitals. But when we go on ground and check, we are told there are none.
Good evening, Tanvi. Thank you for having us. It's indeed very saddening to see what happened to the family of that young kid who was born in an auto. That should never have happened. That should never happen again. So I think what has happened is there has been a sudden exponential increase in the number of COVID cases in a state that had done extremely well for the first 3 months. So an unexpected surge in the number of cases in the state and especially in the city of Bangalore. Now, honestly, I think Bangalore has a very robust number of hospitals, both in the private and in the government sector. We have over 10,000 beds. Where the problem lies, in my opinion, is that we do not have data management and a single authority allocating beds. We should have a real-time dashboard that is accurate online, where the patients can book the bed based on the availability, and an ambulance will pick them up and drop them to the hospital that has a bed available. Patients should never get into the business of being sent from hospital to hospital. It is traumatic, and also it is a huge burden on them running from hospital to hospital when you're sick. So I think we should have a centralized body helpline number, triaging, where they have data on the number of beds, including ICU and other kinds of beds available. The patients can be directed. It should be something like an online booking of an airline ticket. We never run from an airline to airline looking for a ticket. We know whether there's a ticket available or not, and it is booked online. So it should become as simple as that. I believe the government, the BBMP, the Health Commissioner's office is working on this. Hopefully, the system will be tweaked, and we'll have a better management of beds and better management of patients' movement to the hospital that has the bed. Of course, the healthcare workers being in short supply is a problem for two reasons. One is now that any healthcare worker who's affected by COVID, not only does he or she stay home, their first degree contacts, that is people who have worked with them, also are quarantined. So there is a huge loss in the healthcare workers. So we may have to work in shift systems, which further increases the burden of shortage of healthcare workers. But I do believe that if we can keep patients who do not need to be in the hospitals, which is 60 to 80% of them presently, we can move them to either home isolation or COVID care centers. The pressure on the beds in the hospitals will ease. Also, the pressure on the healthcare workers will ease. So I think these are steps in the right direction that are being taken, and hopefully these kind of incidents will not be repeated.
Well, Dr. Ballal, let me just point out to you that the family member that we actually spoke to also mentioned, the hospital on, the chairman of which you are, and said that they were turned away from this hospital as well. Is there an insight you can give us as to what's going wrong in your hospital? Are you overburdened? Are you not taking non-COVID patients? Is something that you can look into?
So Manipal Hospital was one of the first few hospitals to set up COVID-specific hospitals, not only in the city of Bangalore, but also in our district of Udupi, where we had set up the first COVID hospital. And we have a hospital here for COVID. And here the COVID patients are treated. We don't admix patients there because of the risk of transmission of disease to the others. And the admissions to this is also regulated by the BBMP and the Health Commissioner's office. I will certainly inquire into this, and in an emergency, I think we should think out of box and make sure that the patient is safe rather than anything else. But certainly, this is something we will look into.
Okay, yes, please do. You must look into it, because even if it's a dedicated COVID center, there has to be some amount of, flexibility when it comes to emergency. Let me actually bring in Mr. Rajashekar on that. Mr. Rajashekar, if one had to listen to the Chief Minister's comment today, and I'm going to play that out in just a bit, they have made XYZ 1,000 beds available for the city. There is no delay in ambulances. Ambulances are provided to everybody who needs it. They have reserved beds in private hospitals. Everything's fine, except that people who came from outside actually led to a rise in case. Now, is that what your own team also is seeing on ground?
Oh, this is people. It was known that people will come once the lockdown was eased on May 30, May end, towards May end. So it was there. The government had 3 months' time to prepare for this, and they said that we are at par with Italy, and we are preparing the same amount of infrastructure that Italian government is making, and they also calculated that 1.6 to 2% of people will be infected, and we are prepared for that. They announced that 1 lakh beds will be prepared all across the state, and everything was sounded perfect. They were giving statements after statements, and they were very confident. This is all on the paper. On the ground, So it was quite clear that when the lockdown was eased, when people started coming, so all the accolades that the state government took while being a model state and all for controlling the pandemic during the lockdown, so all washed away in no time when people started coming, because there was no infrastructure, no testing centers available, no hospitals were prepared. Government was caught off guard, and this was admitted by both Chief Minister as well as the Medical Education Minister. Chief Minister says in some districts and some places the pandemic is slipping out of hands, while Medical Education Minister said very clearly that we did not expect such kind of a surge in the early July itself. We were prepared for sometime in end of July. So there are a lot of predictive analytics done by various people, and one such analytics says that around 8 lakh people will be infected in Karnataka by end of August. So clearly the government has no idea, no clue. They say everything is fine on paper. Again, the COVID care centers, there was a huge scam that after the media exposed the scam, that the government stepped in, the Chief Minister stepped in fact, and tried to set it right somewhat. And then there are purchase scams and other things that the Congress government is writing, and the government has clarified that, but still there are doubts why the government did not prepare and use the 3-month time that they had to prepare whatever they required, when they knew that they're going to be like another Italy, because the population of Karnataka is roughly same as that of Italy. So they were clearly caught off guard, I think, and they admitted it openly, and they had to blame themselves, nobody else. They did not prepare at all. They did not foresee such numbers will come, because they were quite happy that we controlled everything. We are the model for the rest of the country. So the model from 11th position, from bottom, they have come to 4th position. It's matter of time that they will overtake other states and come to 3rd and 2nd also. So it's written on the wall that Karnataka is going to have a huge number of infections, but they're clearly not prepared. I don't know how they're going to manage now with 1 week lockdown ending tomorrow. So this was not at all useful. I mean, the CM himself admitted that lockdown is not a solution. So I don't know how they're going to handle. It's really scary, and we have already crossed Bombay numbers in the last 3-4 days. Only last 2 days the numbers are down because of lockdown maybe.
Yes.
And the results are coming really late. Results are coming really late because people are not stepping up.
Lockdown can never be a repeated solution, Mr. Rajshekhar, and many experts say that. We repeatedly have highlighted it. It was fine to do it initially because it helped you prepare your policies, put in line your policies, put in line your healthcare infrastructure, plan how you're going to deal with this unprecedented situation. But it cannot be the solution every time you see a spike in cases. Dr. Sylvia Karpagam also, is of that view. So, Dr. Karpagam, what should Bengaluru be doing right now, urgently, so that we don't have the instances that are getting reported on a daily basis of patients, lying on the road, waiting for ambulance, dying while waiting for ambulance, not getting admission in hospitals, private hospitals moving too slowly to bring in additional beds, running short of doctors and medical staff. What needs to be done?
Hi, Tanvi. Thank you. Firstly, I want to respond to what some of the other panelists have said. I think there's a thing. I mean, somebody said that we will, find out who the doctors are who did this today, and then we will suspend them or we'll punish them or penalize them. I think that approach clearly is problematic, because you cannot target the frontline workers for whatever reason, because they are the ones who are actually on the forefront, who are trying to work and make do with all the different limitations. And in fact, it's a systemic or structural problem. It should be the people who are making the decisions or not making decisions who should actually and I think it's very unfair, and it's totally inappropriate to target the doctors and think of suspending people. The other thing they said is that the Bangalore International Exhibition Center is going to be set up. And again, that's a flawed approach, because you cannot have one large center, somewhere on the outskirts of the city and say, we are setting things up. It doesn't work like that. You have to have systems where people can easily access. It should be reachable, and it should be across the city. How is someone who's going to live, who's living, say, in Karakpura Road, going to travel all the way to the Bangalore International Exhibition Center? So the thing is, even the task force, if you see, they're comprised of people who are from these corporate hospitals. Like, they are not people who have any public health or any epidemiological or background or any understanding of what a pandemic is. In fact, Dr. Sudarshan is saying that it came as a big surprise. Why is it a surprise? It's a pandemic. Like, what else did you expect? And this is exactly how they're talking, and they're saying you should think out of the box. No, actually, you should think inside the box. You should think that this is a pandemic, and it's not rocket science. Anyone who has some basic understanding would know what policies are required, and clearly the people making decisions have no clue, and they're not talking to each other. They're each one is working in silos, and of course, some things are being put up now. Like, for example, they're setting up booth level committees, to respond at a very local level, and that's a good thing. They're also issuing BU numbers, like Bangalore urban numbers, to patients. And there are instances of patients who have received some amount of, they haven't had to pay out of pocket in private hospitals. But those are very few and far in between. And if you talk to people who actually lost someone in hospitals, it's really outrageous. And the things that they say is, if we put the patient in the hospital, neither the attenders are allowed to go to the ICU and give something to the patient or see what the patient needs, like basic things. We've heard so many people say the patient was asking for water. And there is a fear even among the healthcare staff to approach patients, partly because of
Yeah.
this huge shortage of PPE kits. And the people working in direct contact with the patients are not just doctors. Just giving doctors PPE kits is not enough. You have the nurses, you have the aides, you have the cleaners, you have the people who are in the mortuaries, you have people dealing with the bodies. They're not less valuable, those lives, and they're the
Correct.
ones who are being completely neglected by this whole system. And this thing of saying we have to, people might have to go and work in shifts. No, they should have had to work in shifts from the beginning, because then what you're doing is you're distributing the human resources so that at any given point that they are available. So now the the shortage, why are health workers getting infected? I think that question has to be asked. Why are health workers
Dr.
falling
Karmakar,
down
if I may just come in. Healthcare workers need to be given the due protection, need to be given that support from the government, and of course private hospitals should manage it themselves. But here are some other examples. Bengaluru residents are now being forced to pay and hire their own ambulances, find makeshift ambulances, take lift from people because ambulances are not available. Just a few days ago, the man actually who lost his baby, again because hospitals denied admission, attempted to sit outside the chief minister's residence and protest, and he was whisked away. Story after story is emerging of how people are getting crushed under this crumbling healthcare infrastructure situation, Mr. Vivek Reddy. And I think that the government is not realizing it. It's not as simple as to say, oh, suddenly a lot of people came in because we unlocked. That was bound to happen. That was supposed to happen. Why were you not ready? And since we unlocked, it's been a month and a half. Why are we still struggling, Mr. Vivek Reddy?
Well, I think the greatest difficulty or the serious problem has been with non-COVID patients trying to get medical help. I think that's been a big challenge here, apart from few cases of COVID patients not getting care. But by and large, if you look at the effort of the state government, I think if we are saying, as Dr. Karpagam Kamath says, that we are unprepared, I mean, you may always critique on the magnitude of preparation. But I think the government has done a fair job when you see that you have a 10,000 bed hospital. It may be far, but at least a hospital is there. You cannot create such big hospitals in dense thickets within the city. So you cannot say that the government is not prepared at all. The government is prepared. But the government has to straighten the private hospital system. I think Dr. Sudarshan Ballal also said that an admixture of COVID patients may create some problems. So that has to be addressed. There are glitches. I don't say that
how are you going to take the patients to this far off hospital, Mr. Vivek Reddy? You don't even have ambulances.
Well, I think Karpagam Kamath says she was referring to patients from Kanakpura Road to Bangalore International Exhibition Center. There is a ring road that reaches that straight away, a Nandi Infrastructure Ring Road. It is hardly about 30 minutes to reach there. And I mean, you can keep blaming these things. But the point is, look at the effort of the government, the brighter side, that a 10,000 facility, which is the biggest in the world, which is not created even in Wuhan, has been created in Bangalore. And we need to give the government its due for that, and also ask the government to move into other areas where there have been big vacuum, where there are big glitches. I think that has to be set right. I guess Rajshekhar also says about certain issues. It's very easy to talk about problems at this stage, or very easy to say critique. But what we would like the opposition to do is, one second, let me just finish, Rajshekhar. What we would like the opposition to do is, the opposition here in Karnataka is only finding fault. It has not come up with any solutions. It is not trying to do the outreach with the government. It is not trying to
I don't have the opposition on this show. I'm not interested in a political fight.
This is the problem.
I don't have an opposition on this show. I have experts.
Since Rajshekhar referred to it, that's why I was telling it. So therefore, these are issues here. The government is doing everything that is possible at its side, and will also ramp up its preparation.
No, I'm sorry. I hope you are wrong here. I hope you are wrong, Mr. Vivek Reddy, when you say the government is doing everything that is possible. Because if this is the government's best, then Bengaluru is in big trouble. That's all I can say. Mr. Rajshekhar wants to come in. Go ahead, please.
Vivek, and I sympathize with Vivek. He has to defend the government. That's his job. So let me do my job. So he said government did everything what they could do. Yes, they did everything. They had infighting between Sriramulu and Sudhakar. They had infighting again between Sudhakar and Ashoka. So there is kind of infighting within the government who has to manage, basically yes, who has to go to media to talk about the preparations of the government. All this is again on paper, nothing on the ground. All right. And they talk about this 10,000 bed COVID center, which is actually around 6,400 something beds there. So they could have just followed the Kerala model, where they have set up multiple centers where they can house 1,000 people each around the city.
No,
instead of
we could
everybody there
in our opinions.
No, this is not opinion. This is you can ask the experts.
You can have a 1,000 bed. One can say have a 10,000 bed. Well, these opinions can vary, but look at the effort of the government in setting it up. Why don't you acknowledge that? Please point out. Please point out where there is a problem. Let us correct it.
No, Mr. Vivek Reddy. We will start applauding this when we will start applauding it when people start benefiting from it. It doesn't matter whether you have 10,000 beds or 20,000 beds in one corner of the city. When you can't provide, Mr. Reddy, what's the point if you can't provide ambulances for people to reach there? What's the point if the ambulance operators are going to charge us 20,000 rupees for one ride? What's the point if you go to the nearby COVID hospital and you are told that you cannot get admitted, there are no beds available? What's the point if you tell us there is an app available that is going to show you the availability of beds in which hospital, government or COVID center or private hospital, but when you call up that hospital, the hospital says the bed is not available. These are hard facts investigated by now, Mr. Reddy. I don't care about what you show on paper, 10,000 beds in whichever corner of the city. If people can't get the treatment when they need it and they're dying on the streets and losing babies, delivering babies in auto rickshaws, bleeding in an auto rickshaw because for 8 hours no hospital gave them admission, then I don't care about your 10,000 bed COVID care center because it's not solving the problem, Mr. Reddy. All amount of denial about ambulances, about availability of bed is of no use if the app that you have designed is not giving me that information, is not giving me correct information. I don't care what you say, Mr. Reddy. If I go to the hospital and the hospital doesn't have a display board with the availability of beds as has been given by the government rules.
And nobody wants to bring in that picture. There are thousands
so, am I supposed to applaud you?
Today,
do I need to tell you what the population of Bengaluru is? Do I need to tell you 70% of the people will have COVID infection within a year? Do I need to tell you that?
The health department is going and checking on them each
This is your job.
Day.
Don't expect me to applaud you for it. I applauded you when you managed to keep the number of cases low. You are losing this battle now, Mr. Vivek Reddy. Please stop being in denial.
I'm not being in denial. What I'm telling you is, Tanvi, because you were just talking now, what I'm telling you is that even at the basic booth level, there has been extraordinary work being done by BBMP doctors, by the BBMP staff, by the Asha Karyakartas, by the social welfare department, by the health department, and they are reaching out to people at that level, at that lower level of booths and homes. And if suppose there is a patient, they are going and checking on that patient in home quarantine. They are going and sealing those premises. Well, all this is being done. This is also a part of the story. I'm not denying that there have been glitches. There have been glitches. But when you prepare for a war of this magnitude, there are bound to be such situations. The effort of the government must be, I also agree, the effort of the government must be to avoid these situations. But please don't paint this as a total failure. That is not the case. There are success stories here. We need to acknowledge that. And all cities have these success stories. It is because not only of the government, it is because of the COVID warriors, the Asha Karyakartas. They are the ones who are standing up today and meeting this crisis.
You tell your success stories to the woman who lost her baby and is in a hospital today, Mr. Vivek Reddy. Tell your success story to the family that lost a beloved family member waiting for an ambulance to turn up.
It should not have
happened. You can go and tell your success stories to them. I'm not going to sit here and give you a report card on whether your success was 30%, 40% or 80%. You can self-rate yourself as long as patients are not finding beds in the city of Bengaluru. I am not convinced of any success stories. If this is the situation in Bengaluru, I shudder to think what is happening in the villages in our country where there may be COVID or non-COVID patients. If there is a problem that on Mirana we've now highlighted for over a month again and again about shortage of doctors in the city of Bengaluru, of medical staff, I want to know what the government has done. Nothing. Nothing has been done so far. The doctors who are on duty are still struggling. Those who are not there are just not able to help. What has the government done? Think about it. Bengaluru was a classic example of how to fight COVID right. How to contact trace people. How to screen and isolate people and keep your numbers low. But the fall from the grace has been swift and has been ugly. And if the government doesn't realize it now, then this city is in big trouble. Thank you so much to all of our panelists for joining us on this conversation. I just want to highlight one more thing before I wrap this up. Here is what Mirror Now has found out. Number one, hospitals are not updating the bed management allotment app. So if you think you can log on to the database and find where there is a bed available, it's not going to help. Best of luck hunting around for it. Hospitals are not admitting patients without a COVID test certificate. If you're a non-COVID patient and you're glad you don't have the infection, well, first, best of luck trying to get yourself tested, get a report, and then see if some hospital will actually admit you. Top 5 hospitals in the city are full. Patients are claiming they don't get beds, and the staff claims they are much short-staffed. This is the reality. Tomorrow we bring you another big expose on the state of healthcare infrastructure in the city of Bengaluru. Stay tuned to us, viewers. Time for a short break. On the other side, we put the spotlight on Tamil Nadu and Tamil Nadu's big violators. You know who they are? The ministers of Tamil Nadu. Stay with me. Welcome back. We put the spotlight on the big violators of social distancing norms, big violators of wearing a mask, maintaining health and hygiene in the state of Tamil Nadu. And you know who they are? They are the ministers, sitting ministers of Tamil Nadu. The state of Tamil Nadu is right on top, viewers, in terms of COVID crisis, topping the charts in terms of number of cases. Every day, even now, in cities like Chennai, over 1,000 cases are being reported. But the ministers are more interested in photo opportunities. And so they are not stopping with their public events. They are not stopping with their rallies and their grand stage events and cameras and pictures and being visible to the crowds. It doesn't matter to them that they are completely violating the norms that they themselves are supposed to teach everybody else. In fact, I'm going to tell you a very interesting fact. You know what happened today? We have two instances that have come just today itself. In the first instance, the Revenue Minister of Tamil Nadu participated in an event in Chennai to inspect the work of the healthcare staff members. And the visuals show you that not just the staff, but the minister and his staff, nobody was following any social distancing, crowding over each other. The staff was trying to get some of the safety kits. The other one is where actually the irony died. Fisheries Minister, Mr. Jayakumar, a big man, very famous name in the state of Tamil Nadu, held an event to spread awareness about social distancing. He spoke to the people there on the importance of social distancing. And I'm just going to leave the visuals for you to see and take a call for yourself if this is how you think this event should have been held. No social distancing at all. We in fact even confronted him and he said no, the experts were there and it was their job and they were ensuring that all rules are followed. The visuals are for you to see. This is not the only time. These two instances have just come in today. Let me tell you, apart from these two instances today, there have been many other such examples, and they start right from the top, from the Chief Minister himself. On June 15th, viewers, the Tamil Nadu Chief Minister attended an event in Salem. And there were over 500 people who had gathered there, and social distancing norms were flouted. Now, you may say it's not the Chief Minister's job. It is the Chief Minister's job to at least pull up people who don't do their job and to ensure that at least in his own event, they lead by example. A Tamil Nadu minister on June 1st failed to wear a mask properly, roaming around on the streets, riding pillion, not even wearing a helmet, let alone wearing a mask. Another minister attended an event in Madurai on May 22nd. Again, no social distancing norms followed. The Revenue Minister had also, earlier on April 22nd, attended an event in Madurai. No social distancing norms followed. Now, at that point of time, when we had raised this, we were told that, well, they are also learning, they will get used to it, they also don't understand, they are trying to follow norms, they need to tell people, they need to do their job. But I fail to understand how something that has been a reality of our country from mid-March has still not been drilled into the minds of these netas. How is it that without any kind of a responsibility or a shred of burden, they go about blatantly violating the norms and risking other people's lives? Now, let me say good evening to the panelists who are joining us on this specific conversation. And I have actually got Dr. Kani Modi, spokesperson for the DMK, joining us right now. Jairam Venkateshan, convener of the Arpur Ayakam, a social activist who is with us this evening. And Mr. Radhakrishnan, associate editor of the Frontline magazine of the Hindu group, joins us this evening. Mr. Radhakrishnan, let me start with you. It's not specific to Tamil Nadu. We've seen ministers violate norms even in some of the other states. But it's specifically concerning to me that it happens at such a large scale in Tamil Nadu, a state which is struggling with COVID. Why do you think the politicians are not getting the message?
No, they just don't give a damn, because we see the chief minister who makes it a point to travel some 300 kilometers to just open a reservoir to let out water into the Kaveri, the Mettur reservoir. You had the press in full strength there, zero social distancing in the chief minister's meeting. If the chief minister wanted it, or any of his entourage wanted it, easily this could have been prevented. And that explains why 4 ministers got COVID. The examples that you said in Madurai, for instance, it's a complete mess. The Madurai is the second most affected town in Tamil Nadu. There have been over 50 deaths in just this one town. And you can see all over the place. You see, you take a D. Jayakumar, very senior minister, has been in the cabinet from 1991, Jayalalitha's first ministry. His own constituency, Royapuram, is where the biggest violations happen Sunday after Sunday after Sunday when people come to buy fish. He just cannot even control that one crowd. He can't tell the fishermen of his own people, these are his own people, his own constituents. He can't tell them to maintain social distance, to just, not sell to everyone and sell only to the wholesalers. We see this all over the place. Everywhere the ministers want to be seen as doing work. They do the so-called reviews. Every time they go from point A to point B, they have to not only be doing the reviews, they want to be seen as doing the reviews. So they invite all the press to come along. So absolutely zero social distancing, to the extent that you have the policemen who form the buffer between the minister and the people. They are the ones in the line of fire. They are the ones who indulge in pushing and shoving people so that the press can come in front and cover the minister's, forwards or whatever. Every single point that the minister visits, he wants to say something. He wants to be in the TV at that hour, and that is actually the bigger problem. The second problem, of course, is competing with the DMK, which has been distributing relief all over the place. Yes, there have been social distancing problems in those meetings also, but the ministers do go even further than that, and they do exactly what nobody should be doing. We're going very close to people for just a picture. They want to show that there is so much of distribution being done, so many people have come, so many people have benefited, and unless they get that picture, all the people in just one frame, it is not just enough. And each time there is a press conference, you can see all these chelas standing behind, and they want to be in the frame as well. No social distancing there, because they think it is more important to be in the frame than to contact COVID.
Yes, absolutely. And everybody wants to impress their political bosses, so they are all falling over each other, which is why, ministers can't get away by saying that, well, we had clear intentions and we had good intentions. It's just that at that point of time, some people may have violated norms. It's your responsibility and your team's responsibility to ensure this doesn't happen. Dr. Kanimuri, is there a problem? Is it that people don't, ministers and politicians are not understanding? Should we ask political parties, and this is across the, party lines in every other state, should we ask political parties to hold special classes for the netas?
I don't think so like that, ma'am. Actually, if you go to see the Ondranevam program, which has been conducted by our President, Mr. M.K. Stalin, you can see how many people are being benefited, which should have been actually done by the Tamil Nadu government and by the ministers and the CM giving the measures which is required for the people. We have been maintaining the social distancing in all the programs. All that 1 meter distance has been maintained. Seating arrangements has been made. They have been given proper token. Nobody is asked to come and follow over each other. And people have been maintained paka. You can go through all the footages of the DMK programs and just watch it. Here I would also like to quote an example. We have lost the CMO office PS, which is a very good example of how the government is running. They are not able to control the COVID in their own government office, which is the state office, which is the government office. That itself shows as an example that they are not able to control it. And today, Minister Jayakumar is giving us an interview. I have given the instructions and it is printed on the invitation. It means you give an instruction and it is printed on the invitation. It's not that the minister should not follow. Your own Times of India people are interviewing him, and we have the footage which was shown at 6 p.m. news today, which clearly says that you are coming and standing next to me. And when he is saying the same words, you can see thousands of people standing behind him before he could enter the car to just to see the minister off, to show the faces in the video. This shows how much of control they have over the own people. As Mr. Radhakrishnan said, RK Nagar is one of the most increased number, RK Nagar and Royapuram is the number of increased cases in COVID. It's simply because of the Kasimeda fish market. The minister is not able to close that. This shows how the government is being run in Tamil Nadu, ma'am.
Yes, absolutely. And every time you ask the ministers, and that's the interesting part, they deny responsibility. Mr. Jayaram Venkateshan, every time we've confronted, be it Mr. Jayakumar today or the health minister earlier, every time they deny responsibility. They say, oh no, such thing happened. You're also here. You're also standing next to us and talking to us. Then why are you complaining about it?
In fact, that is the very problem. The acceptance of the problem will be the first step towards the solution. Here we are seeing ministers who are not even accepting it as a problem. They are completely denying that such a thing has happened. When, in Salem, more than 500 people have assembled, when it's on TV, completely everyone is able to see it. Our health minister, Vijay Bhaskar, is saying no rules have been flouted. This is a clear violation of all kind of rules. We have to understand that people can't even organize a marriage function with 50 people. Cannot even for funeral, people are not allowed to go. It's because we are in a pandemic, and every half an hour our chief minister comes on TV, gives an advertisement saying that people should maintain social distance norms. Where is your social distance norm? What are you following? And here we are seeing not only Mr. Chief Minister, as said in Madurai, Minister Sellur Raju, we saw him last month without mask, and he had contracted COVID after that. We must understand that he had contracted COVID after that. So therefore, they are putting not only themselves at risk, they are putting the people of the city, people of the state at risk as well. If these 500 people contract the virus, and then if they go to their family, and it will spread around, and therefore it is the proof of pudding is in eating. So these ministers, instead of just preaching, they should first follow it, they should first practice it, and then tell the people. And the other important issue is that when something like this happens, what is the police doing? You see, the police have to take accountability. They have been booking people left and right for violating the norms of the lockdown, violating the norms of social distancing. What about the chief minister? Under the disaster management rule, see, the central ministry has given directions, the state ministry has given directions to book people under section 50 to 60 of the Disaster Management Act. The Disaster Management Act 51B very clearly says if someone refuses to comply with any direction given by the central or the state government, then they shall be punishable with imprisonment for a term extended up to 1 year. So therefore,
who's going to take any action?
Yes, of course, the DGP...
Mr. Venkateshan, who's going to take any action against the Chief Minister, Fisheries Minister, Urban Development, Health? I mean, what I find most appalling is, and this is not just Tamil Nadu, in many other states, it's the health ministers who get it wrong the most number of times. It's the health ministers who've been seen violating the social distancing norm, not wearing masks, the most number of times. And they're in charge of our health department. They're the ones who should be leading by examples. Unfortunately, our political leaders are only leading us in violations and nothing else. I just want to thank the our panelists for joining us right now. But I actually want to very quickly play out the entire sequence when our reporter confronted the minister and asked him if he thought this makes sense, that you hold an event in reference to COVID, but you forget the rules about COVID at that event itself. Please just listen to the way the minister is responding.
So what are the purpose of these rallies in the first place?
To create awareness among the people.
But unfortunately, we couldn't see any social distancing. Even now behind you, people are walking so
close. We are fully instructed to maintain the social distance. According to that only they maintained. Okay?
But this is not distance, sir. You need at least 2 feet distance.
We have given instruction. So only, see, you see my actual invitation. You see my invitation. In that invitation, it is clearly mentioned. only through social distance only the rally will be. Okay.
Then why is that people are not maintaining social distancing in this area, sir? Because the
You are, see, you are also you are also coming close to me.
2 feet away, I'm standing from you.
You are
2 feet away, I'm standing from you. That's why I'm holding a stick here.
you are also coming close to me.
No, but asking this,
When I indicated only, you actually keep away from me.
at least a feet away, I was standing from you since the beginning. That's why we have the stick
So
here.
we have given instruction. Definitely, that is not at all issue. They will maintain the social distance.
Don't you think these kind of rallies and programs itself are causing kind of danger to social distancing?
Definitely, it will create awareness. Okay,
This way.
that too. The rally is organized by NGOs only. So they will actually maintain the proper protocol. Okay.
But do you agree social distancing was maintained here today?
Yes, it has been maintained. That is ensured by the NGOs. Okay.
Well, we also have a poll that's going on our social media. Do you agree with this defense or not? I think we want to hear from you as well, viewers, on what do you think. You heard the minister's clarification. Is that enough? Is that good enough? Is this how the Tamil Nadu government is actually going to lead the state of Tamil Nadu out of the COVID mess by breaking the rules themselves? Think about it and do respond to us. Completely out of time on this edition of the debate. Thank you to all of our panelists for joining us.